Exactly. Okay, here is your question. Yes. You've read?
Yes.
Okay, if you have read and understood, considering the communication skills station, kindly please begin.
Hello, sir. I'm Dr. X, one of surgical doctor here in hospital. Can I confirm your name, please?
Okay, I'm Smith, 59 years old male.
Hello, Mr. Smith. Nice to meet you. Please, has anyone spoke to you about this procedure before?
No, not yet, doctor.
Okay, can you tell me, please, what do you know far about this?
Okay, so I had an investigation before what you call the X-ray with some dye or something. They found some abnormality there. Now they want to do a scope. So they said a pipe will insert it in my throat. So that how far I only know.
Okay, let me explain to you what's the procedure. What we call the esophagogastroduodenoscopy, and which can abbreviate it to OGD, esophagogastroduodenoscopy. As this scope, has a camera, and this camera installed into your mouth, then pass into your food pipe, after that to your stomach, and the first part of small intestine. At this time, we will doing that under anesthesia or drowsy under sedation that make you slightly drowsy, and you feel not any pain. Also, this camera will relay the screen at TV that will help us to see what problem inside. Also, we will make widening of the narrow part of your food pipe, and maybe take some samples to investigate and to rule out what is the problem in your about your case.
Is it painful,
Also,
doctor?
no, we will make that under drowsy. We will make under what's called sedation that make you just drowsy and no pain. And if you want, we can arrange discussion time with anesthesia before the operation that explain more about if you want.
So is there any risk for this operation?
Oh, Mr. Smith, any procedure that are having risk, but not all risk should be done. This risk maybe when installed this camera, maybe do fracture of your tooth, and also maybe injury of your food pipe, also maybe bleeding, maybe infection. But don't listen to these risk should be done. At this procedure, only skilled surgeon and experienced surgeon only allowed to perform this procedure. So don't worry about that.
Oh, doctor, I'm very scared. I don't want to perform the operation.
Oh, Mr. Smith, as I told you, listening to this risk does not mean that will essentially happen. So my advice to you is that accept this investigation. It is important for you at this time.
So,
Hello?
doctor, why I keep salivating?
Yeah, I think that's due to the narrowing of your food pipe that inhibit your salivation to flow smoothly downward.
So is it a cancer?
It's early to confirm that. For that, we need to do this procedure, and this procedure will help us to investigate what's the problem. So wait until the result appearing. After that,
So
we
when
can
the
know, is this
result will
cancer?
come?
Okay, this result will appear within 2 weeks.
Okay. So do I have to stay in the hospital?
So after you regain your conscious, and we'll check you, and you can go to home. But you need to have someone with you when you go to home.
Okay. So have you seen my previous investigation?
No, sir, I'm not sick.
Okay. So you don't know that is there anything abnormal or not?
No, sir.
Okay. Okay, doctor, I understand.
Any other question?
No.
Eating around the
Okay.
time of OGT.
Okay. So I will summarize to you that we are going to do what we call gastroesophageal, and we will doing that under anesthesia that make you slightly drowsy and no pain. Also, we'll discuss the risk and all question I answer to it. Can you please assign the
No,
console?
wait. Tell about the food he cannot eat during, or what hot drinks he cannot take during the time of OGT. Give that advice as well, please.
Yes. So I really don't have that.
You don't? Okay. All right. It's given on page 9 of Sing Notes. Patient has to avoid the hot drinks during around the times of OGD, and has to burn off like around 1:30, half an hour to 1 hour before. And if sedation is given, then patient has to bring someone to accompany him back home. He cannot just go on his own, and he cannot
He
drive the
cannot
car
drive alone.
the
Yes.
car
Yeah.
back home as
Don't,
well.
yeah. You
And
need to have someone with you
at
when going to home.
after midnight, patient does not have to have to stop eating and drinking. And if it's the OGD is in the morning, and if it's in the afternoon, then light breakfast patient can eat around 8 a.m. and no food or drinks after that, and the small amount of water patient can take even 2 hours before the procedure. And the medications patient can take with a sip of water, regular medication. Then you can ask check the understanding of the patient, make patient explain everything that you have explained it to the patient, and then make patient give you consent. Good.
And when I ask you how many days it will take, so just not say only like 2 weeks. You have to say it might be 2 weeks, but as soon as possible when it out, we will let you know.
Have you people discussed alternatives? That if I don't have to go through this procedure, is there any other procedure that I can go through instead?
No, I didn't ask him.
Yeah, should have. Because the alternative is bell has gone. Barium swallow, but then a candidate will explain that, okay, there is an alternative that we can offer you, but that is not conclusive, because in that one we cannot, it's not therapeutic or diagnostic, because we cannot take a biopsy and we cannot even do the dilatation. Whereas in this OGD procedure, we have the possibility of taking a sample for biopsy, and even if there is any constriction or restriction, then we can dilate that as well.
Okay.
Good. All others, everything else was covered. Good. Thank you.